Hey everyone, and welcome back to TheFortitudeFix. I hope you're well. My name is DaShanna, and in today's video, we are gonna roll it back just a little bit. We're gonna be talking about fibroids, but I'm gonna take y'all back to literal step one. What are fibroids? All right, so on this channel, I talked about my journey with fibroids as well as being pregnant with them and how it impacted my pregnancy. I even have a video where I take you along to my OB appointment and you can see how big my fibroid was, or is. It's not as big, but how big it was while I was pregnant. Y'all, those videos have done so well on this channel. I get so many comments from you all about fibroids and about questions that you have fibroids. You're letting me know that your doctor just told you, that you just found out that they're causing issues for you, that you want to make sure you get all the information. A lot of you are coming to YouTube for the information. So I just wanted to add a little bit more to the pot of fibroid information out there based on what I have learned, what I have experienced, as well as what I have researched. Let's go ahead, without further ado, let's get into what fibroids are. I'm going to be talking about what they are, what they're not, risk factors. We're going to be talking about treatment options. So if you're interested in all that stuff, go ahead and just keep on watching. Let's start off with what fibroids are. So fibroids are also known as leiomyomas, and they are non-cancerous overgrowths that live within the uterus or the uterine wall. They are super common, with about 20 to 50% of folks with the uterus expressing that they have had them by age 50. And also 50% of people who have fibroids, they never cause an issue for them. They never cause problems. That was my story. I fell into that 50% as I never experienced issues with my fibroids, and I really was reminded of them, or it was made a bigger deal when I was pregnant, and they wanted to keep a close eye on them. More than 50% of those who have fibroids are asymptomatic or do not experience any symptoms related to the fibroids. And so they might often find out that they have fibroids during other types of procedures or ultrasounds or things like that. All right, so again, these are non-cancerous, okay? These are benign growths, and they do not increase one's chances of getting uterine cancer or cancer of the uterus. So I want you all to know that those two things are separate and they do not have an effect on one another. The percentage of these growths being cancerous is super low, like it's 0.05 or something like that. And so again, nothing fully is 100% in this world of the practice of medicine, but that's what we know as of right now. All right, let's go ahead and talk about some risk factors. Some risk factors include age. Older women, folks with uterus, are more prone to having fibroids. Also, Black race, being Black or African American, puts us at a higher risk of fibroids. Obesity is also a risk factor. Nulliparity is also a risk factor. Another risk factor is family history. More risk factors include vitamin D deficiency, exposure to food additives, and the use or consumption of soy milk. There are different ways to classify a fibroid. I believe medical professionals will use like a scale of 0 to 8, really depending on the type of fibroids that someone has. And it is common for people to have different types of fibroids. One fibroid is this, another fibroid is that. So it is possible, but I'm just going to talk about 3 main classifications. So you can have something that is subserosal, you can have one that is submucosal, and then you can also have like a hybrid. And so that rating scale of 0 to 8 is really kind of where that fibroid falls. You can have fibroids inside of your uterus, you can have them outside, you can have them in the uterine wall pushing in, you can have them in the uterine wall pushing out, it can be in the muscle. There's so many definitions. And so really talking to your healthcare provider and asking all the questions, having them explain it to you, having them show pictures, and really knowing what kinds of fibroids that you have is going to be helpful, because it can help you really tie your symptoms, if any, to the type of fibroids you have, as well as it'll help you and your healthcare professionals really identify possible treatment options, if any. this is what I was told. I was told that there really is no reason to interfere with the fibroids if they are not causing issues. That is just my case. I had them before pregnancy. I birthed 2 babies and I still have them. So I have not had my fibroids removed. My fibroids didn't cause any problems with me being able to deliver both of my girls vaginally, and I don't have any issues with some of the other symptoms that fibroids might affect. So let's go ahead and talk about some common things that fibroids could cause if someone is indeed experiencing symptoms. So the first one is heavy or prolonged menstrual bleeding. So when someone is having their period and it's just lasting super long, it's extremely heavy, it's very uncomfortable, that is something that fibroids can cause. Another symptom or something that fibroids can cause is just really the bulk. This means that someone has super large fibroids. Maybe there's lots and lots of fibroids, right? I only had 2 to 3. Some people have a lot, upwards of 14, 15 fibroids or more. These fibroids obviously take up space, and so it can be pushing on other things. Bulk fibroids can really cause things like pelvic pressure, can cause urinary tract infections or bowel issues. And there's also a concern for degeneration. And then fibroids can also cause things like reproductive issues. So abruption malformation, it can cause issues with conception, preterm labor, things of that sort. So there are symptoms, although more than 50% of people with fibroids are asymptomatic, there are symptoms that can be caused by fibroids. All right, let's go ahead and talk about some treatments for fibroids. So treatments for fibroids are really going to be broken down into 2 separate categories. There are going to be medical treatments for fibroids, and then there are going to be surgical treatments for fibroids. So if you want me to go more in detail in a separate video about treatments of fibroids, I can do that. But for now, I just want to let y'all know that surgery is not the only option to deal with fibroids. It is going to depend on the type of fibroids that you have, where they are located, the size of them, etc., as to what treatments might be the best for you. Maybe I will. Yeah, go ahead and like this video and leave me a comment below if you want me to do a separate video, just because some of the treatments are tied to certain symptoms and issues and locations of fibroids, and so some might be better, some might not be, and so your doctors might actually recommend certain treatments over others because of those pieces of information. So I might do that in a separate video, but just know, yes, there are medical treatments and then there also are surgical treatments. And then even when you are looking at something like surgical procedures for the treatment of fibroids, it's not always going to be to remove someone's uterus, okay? There are multiple examples of surgical treatments that are available. And then also within surgical treatments, there are 2 subclasses of those surgical treatments. So one surgical treatment is going to be uterine saving, and then another is going to be non-uterine saving. And so typically those non-uterine saving procedures will happen once the other medical treatments or the uterine saving options have failed, kind of like a last resort. All right. So that brings us to the end of this video. I really do hope that you learned something. I hope that this little crash course in fibroids was helpful. Please go ahead and give this video a thumbs up. Leave me a comment down below to let me know that you are here, and click that subscribe button and join the fam. I would love to have you be a part of this online community here that I am building. I do have a goal of making it to 10,000 subscribers, so go ahead and subscribe. It is completely free, and I'm going to be bringing value-filled content to you every single time, so you will not regret your decision. I'm so happy to have you here. I will go ahead and leave some videos up here for y'all to watch between now and my next upload. I will see you all right back here next week in another video, and as always, remember to fill your cup. Bye.